Well, hello everyone, and welcome to Heluna Health's Population Health Matters live stream series. We're so glad you could tune in today. Today is March 8th, which means it's International Women's Day, so happy International Women's Day. My name is Sarah Lichman, and I'm the Director of Media Strategy at Heluna Health. I'm joined today by Wendy Fung and K'Lynn Mitchell, who are both registered dietitians within Heluna Health's Breastfeeding and Nutrition Services. March is National Nutrition Month, so of course we're going to be talking about all things nutrition, but we'll be focusing in on the theme of Beyond the Table and talking about the intersection of public and population health, health equity, and culturally relevant community-centered programs. Heluna Health's breastfeeding and nutrition teams provide family nutrition and breastfeeding assistance in diverse communities at nearly 40 sites across Southern California through USDA-funded Women, Infants, and Children Supplemental Nutrition Program, commonly known as WIC, and reach approximately 4% of the nation's total and 23% of California's participants in WIC. Heluna Health has successfully implemented a number of services that leverage the strength of the WIC program, services that work because of the connections that WIC has established with families to meet them in their communities. I'll start by introducing K'Lynn Mitchell, who is the Cinemoms Project Coordinator at PHFE WIC. Her role involves managing various grant projects, supervising a team of project specialists, and collaborating closely with community organizations to address and reduce health disparities, particularly in Black infant and maternal mortality, Her journey in nutrition and maternal health began at Cal Poly San Luis Obispo, where she earned her Bachelor of Science degree in Applied Nutrition. At PHFE WIC, she has grown in her career from a nutritionist to her current leadership role, advocating for vulnerable populations and championing health equity among Black, African American, and African WIC families. In addition to her nutritional expertise, K'Lynn is a professional movement teacher and a certified yoga instructor. For the past 4 years, she's been teaching yoga, emphasizing joyful movement for all body sizes. This unique skill set enhances her work at Cinemoms, where she leads meditations, yoga sessions, and mindfulness activities. She is also currently pursuing a master's degree in public health from Cal State LA, focusing on urban community health. Welcome, K'Lynn.
Thank you, Sarah. Glad to be here.
And I'd also like to introduce Wendy Fung, who is the Breastfeeding Services Manager and Regional Breastfeeding Liaison at PHFE WIC in Los Angeles County. She also serves as co-founder of the Asian and Pacific Islander Breastfeeding Task Force. In these roles, she helps moms to overcome breastfeeding challenges and strives to establish connections with other organizations to improve breastfeeding support, encourage moms to persevere with their breastfeeding goals, and promote exclusive breastfeeding. Wendy's journey into breastfeeding support and advocacy began when she started working with WIC as a registered dietitian in 2011. Wendy enjoys learning about the struggles of her community and uncovering the barriers that affect their willingness to support long-term breastfeeding. Wendy works to raise awareness about Asian American Pacific Islander breastfeeding and solicit general community support in helping the Asian community members to breastfeed more. Welcome, Wendy.
Thank you. It's my honor to be here with you all today.
Well, let's jump right into the questions. But before we do, a quick note to our audience. If you're watching live, please feel free to submit questions to our panelists in the chat. So let's get into it. Wendy, I'm hoping that you can kick us off by telling us about your role at WIC and also a little bit about how you incorporate health equity into what you do.
Definitely, it's my honor. As Sarah mentioned, WIC stands for Women, Infant, Children Program. It is part of the USDA program. We serve middle to low-income families who are currently pregnant women, breastfeeding women, non-breastfeeding women, or who recently had a miscarriage, and children from birth to age of 5. WIC provides nutrition counseling by registered dietitians like myself and K'Lynn and degree nutritionists. We offer breastfeeding education and support by lactation consultants and certified lactation educators. We offer referrals to other programs like healthcare providers, immunizations, and of course, The most important piece here, we offer healthy and nutritious foods. So my role here from day to day is actually change. It varies because I do have a dual role as a regional breastfeeding liaison and breastfeeding services manager. As the regional breastfeeding liaison role, I connect with local hospitals, clinics, and healthcare providers, making sure they are referring their patients to us for nutrition and breastfeeding education and support. We want to continue the continuity of care in the healthcare for all nutrition and breastfeeding aspect. I co-supervise a team of 30 peer counselors who provide direct contact to our families with breastfeeding support and education. So since we're talking about National Nutrition Month today, it is so important to focus on the theme, which is beyond the table, to address farm to fork aspect of nutrition and describe various ways we eat. I love that we're talking about different ways we eat because how I eat is so different than how you, Sarah, and K'Lynn eat. Our culture shape our diet, shape the way of what we eat. So at PHRV Week here, we see the important correlations between nutrition and culture. So we grow our own in-house registered dietitian who come from different cultures and speak different languages. Now, the WIC communities, our WIC community, can receive care, education, from nutrition to breastfeeding from someone who came from their own culture and who speaks their language, who understands what they eat. Therefore, it is so important to continue to achieve health equity. We need to hire more people who come from different communities, who speak different language, and who understand their cultural practices.
Well, that's great, Wendy. Thank you for sharing that. And I really appreciate your insight. And I want to kick it over to K'Lynn next to tell us about her program, Cinemoms, which is a really wonderful and unique program. K'Lynn?
Yes, so Cinemoms is a value-added program within PHFE WIC, and we provide a supportive space for pregnant and postpartum Black African American and African women participating in our local agency. Our vision is to reimagine breastfeeding, parenthood, health, and healing for Black families through advocacy, inspiration, and community. So Cinemoms is essentially health equity. As the Cinemoms project coordinator, there's so many different things I do on a day-to-day basis, but overall, I am in charge of making sure that our program is running strong, making sure that our programming reflects the needs of our families, coordinating with other local community partners working in the Black maternal health ecosystem to really band together our resources and provide what's most needed at the most critical time during our families' period of growing and having more kids and providing that support.
That's great. And that's really impactful work that you guys are doing at Cinemoms. Thank you for sharing, K'Lynn. And I want to be respectful of everyone's time. It's a Friday, and I know people have weekend plans. So I want to switch over to taking some questions from our live audience. So as a reminder, for those of you who are watching live, please feel free to submit questions for our panelists in the chat. I'm looking now, and it looks like we've already had one question from our audience, and it looks like it's for you, Wendy. The question asks, Wendy, what are some of the cultural roadblocks or barriers to breastfeeding, and how does WIC support families in overcoming those barriers?
Amazing. I love to talk about breastfeeding. That's my role here. So in National Nutrition Month, we also have to acknowledge where nutrition all begins with the first food, which is breast milk. So at PHFU WIC, breastfeeding support and education is one of our 4 core services. We tackle the cultural barriers by hiring and training or growing lactation consultants who speaks the same language and understand the same cultural practices as our work clients and community. For example, I'm Chinese. I understand that the importance of postpartum rest periods within the first 30 days of baby's life. Therefore, when I help my Chinese family on breastfeeding support after their baby is born, I understand and I also respect them that it's okay that they don't come into the WIC office for help, but I can offer them telehealth visits or virtual health visits through a Zoom platform to check in to see how's baby latching, how's baby feeding, and so on. So I would say it is so important to continue to achieve the health equity piece by bringing more faces from different communities, language from different communities to continue to support our WIC families.
Yeah, thank you for sharing that. And this question didn't come in from the audience, but I would like to kind of ask K'Lynn the same question and talk about, what kind of cultural barriers you're seeing in the community with Cinemoms, and how does Cinemoms help families overcome those barriers?
So where Cinemoms comes in is just providing that support and being that person where you can connect with the mom. Like Wendy said, our cultures are deeply connected. So whenever we're able to understand the other person on a more personal level, you're able to provide much more meaningful support to them. With Cinemoms, what we do is hire people from the community that look like us. So we have a diverse range of breastfeeding peer counselors that are African American. I think we have the most amount of African American peer counselors in our agency, and we are encouraging our staff to go down the path of the IBCLC route, because when you look at the demographics of who's IBCLCs, the majority is white women. So when you're looking at the overall demographic of the families that we serve, they are many different cultures. So when you're able to create that path to the career for people in underserved communities, it really helps to bolster the already amazing breastfeeding support that we provide.
I'm sorry, I'm muted. We had a question come in from the audience. Wendy, I think this is a question for you. The audience member asks, what is IBCLC?
That's a great question. I apologize that we didn't use the proper terms on a live panel like this. IBCLC stands for International Board Certified Lactation Educator. Sorry, let me repeat. International Board Certified Lactation Consultant. That's what IBCLC stands for. And also, just a few days ago, March 6th, I'm so sorry, March 6th was the International Board Certified Lactation Consultants Day. So shout out to all the IBCLC out there.
Great, thank you so much for that, Wendy. Let me check and see if there are any other questions from the audience. I want to be respectful of everyone's time today and make sure that we can enjoy the beautiful weather we're having. But I don't see any other questions, and we're just about at time. So I really want to thank you both for being here and for sharing your expertise with us. And thank you for those of you who are able to join us live. Please make sure to follow Heluna Health, PHFE, WIC, and Cinemoms on all of our social media channels. Our next Population Health Matters live stream is coming up in April. And I'm hoping, K'Lynn, you can tell us a little bit about a celebration that's coming up as well.
Yes, so Cinemoms had the opportunity to expand our services to create a physical location called Cinemoms Crenshaw, created by and for Black women. And we serve the Crenshaw community in South LA. We opened on Juneteenth 2023, so we have our 1-year anniversary coming up. And our mission for Cinemoms Crenshaw is to be a place for mothers to rest, nest, connect, and receive vital support and resources necessary to better their health and pregnancy outcomes. And so far at Cinemoms Crenshaw, we've had over 15 events. Most recently, we had a cooking demo for Black History Month, and the theme of that cooking demo was from Lagos to Louisiana, eating across the Black diaspora and learning the history behind why we eat certain foods during certain cultural celebrations. So, private chef was able to come out and do a live cooking demo showing families how to use their benefits to buy the ingredients. She made Nigerian jollof rice, a Caribbean plantain flan. She made Haitian pickled vegetables. So and lentils. So all of the programming that we put into Cinemoms Crenshaw is unique and all grant funded. So any way that we can get support to continue to offer those types of amazing services is always appreciated.
Great. So everyone, stay tuned for all of the great things coming out of Cinemoms. And again, our next Population Health Matters live stream is coming up in April as well. We'll be discussing Black maternal health. So please keep an eye out on our social media channels. More details to come. Please join us again next month. Thank you again, both of you, for joining me. Thank you to everyone who joined live. Have a great day, everyone.
Thank you.
Thank you.